if there's anything that anyone has as an idea that they want to make sure that I know about, even if you don't, even in this setting, if you decide that you want to reach out to us, you know, we have all your contact. And I hope, as when we leave today, that I would like to sort of, even on an informal basis, keep this group going as feedback for, as we act on things at the federal level, to see what you think, to see what, whether you think some steps we might take are effective or are worthwhile taking, you know, before we take them. So I would love to sort of keep this as an, even if we don't always physically meet, but just to, you know, email-wise and contact-wise, because that would be incredibly helpful to me to make sure that what we do is helpful and that we're focusing on the right things. Chief Rowe?
I think that, you know, I'm frustrated and I sense frustration in this room in law enforcement regarding this issue. Law enforcement has to do something about the symbiotic relationship between supply and demand. And I think that law enforcement has the ability to affect one side of it, and I think that's the supply side. And how we do that is by arresting people, and I've heard a lot about we can't arrest our way out of it. And I think arresting is part of it. I think after they get arrested, they have to be incarcerated. And when they're incarcerated, they need the treatment. That's a perfect opportunity for treatment to be given, as I understand it. I have been told that you can spend however long it is in prison as an addict, and you come out, you are still an addict. And that is the problem. There isn't a lot of talk about the victims in our communities. We made an arrest in January of a woman in 2 weeks burglarized 15 homes. 15 homes. One, a heroin addict. You know, this is an ugly octopus. This goes way out into the community. And you know, the education, it's a three-pronged stool. It's the education, treatment, and enforcement. And I think that part of that can be accomplished by working together. The law enforcement can put them in a position where they can get the treatment. You know, we have to get away from, well, it costs too much money to put them in prison. How much should it cost those 15 families? You know, I think it'd been a lot cheaper to just lock that person up for a year, or however long. Those people, some of those people can't even go back into their own homes, as we all know here. They just feel so violated to have their homes, you know. So it's, you know, we've got to start, you know, getting in there, and I think we have to arrest, not our way out of it, but we got to stop hearing it costs too much to put them in prison. We can't wait to educate the 7th and 8th graders so that by the time they're 17, 18, and 19, they're not going to be breaking into homes. So we have to do something now.
Senator, if I can just follow up
Of course.
on Chief's perspective, from a public health perspective, we're trying to get as upstream as possible. And it always does my heart good to hear law enforcement talk about prevention, because it is a three-pronged approach. There's the criminal component, there's the treatment component, but we have to invest some dollars as far upstream as we can. We have what we call adverse childhood events, and we know that the less trauma that kids are exposed to, the less likely they are to engage in risky behaviors.
Of course.
The good news is the percentage is very low of people who are starting with heroin. It's usually the conversion from something else, so we need to continue to push that message. And the only other thing I want to say that hasn't been mentioned is, and you mentioned it briefly, is quality of life. And I'll tell you, there isn't a day that goes by where my office doesn't get called to go pick up used needles in the city. We're finding them everywhere. Street corners, people's driveways, alleys, woods. And I'm concerned the long-range implication of this continued needle use is we're going to see more Hep C, we're going to see more HIV. So this all has to be part of the messaging as we move forward.
And also as we're getting it out to the younger generation. Doctor?
Senator, three things have popped into my head that I conceivably interface with the federal government, and I don't know if it does or not. Is it a state responsibility or is it a federal responsibility to cultivate better collaboration across state borders? You know, somebody dropped the L word earlier. Lawrence or Lowell or whatever. But I can't tell you how many of our histories include one of the L towns.
Right.
And I don't know, maybe there is already collaboration there that I don't know about. Obviously, I'm not boots on
Yeah.
the ground. Secondly, the corridors that from which these are distributed are obviously 91, 95. If you look at the zip code analysis, it's a broad swath between Keene and the seacoast, Lakes region in the north, and the border in the south. Is it a federal responsibility to enhance interdiction efforts at the distribution? You're not even bothering the end users. You're not even hassling the end users. This is at the distribution level. And thirdly, and I think this is a federal responsibility, not a state responsibility. If I'm distributing, I've got an eye on these regional airports instead of Logan, for example. Why not Manchester? Why not Portland? Burlington maybe is a little far north. Hartford, for example. Do the folks that do the interdiction at those in those areas have the resources that they need? And is there anything that you folks can provide for them to before the stuff even gets on the street?
Right. DEA, ICE, all the federal agencies too, are focusing on those issues. Well, I appreciate that. Thank you, Dr. Andrew. I've sort of been taking notes here of what you have all said, and obviously it does break down to sort of the three enforcement, treatment, and education, right? Those are three big things. And, I think there are some things that we've talked about around this room that is an important role for the federal government. Let's not kid ourselves, we are invested significantly at the federal level in terms of whether it's DEA, other federal agencies, but on this issue of stopping illegal drug use. And the question is, so we've already kind of made our decision on that, I think. So, there's been decisions already made that, and the way that drugs are distributed is that it doesn't just show up in New Hampshire. It has to come across borders, it has to come across states, and so there is an important, I think, role in terms of what we're doing at the federal level, but obviously an incredible important role at the state level with the Attorney General, his drug task force, state law enforcement, and local law enforcement, so that the federal government can't do it all, but we can be, I think, an important player at the table if we're devoting the right resources to it, that we're focusing on what are the right policies. And we've had some major education campaigns that have come from a federal level. And so I think that there is, as we look at what we're doing on that front, that I'd like to explore what that possibility would be as well, because this isn't the first time that we've dedicated resources to say this is such a big epidemic.